I had the pleasure to introduce Dr. Alexis Ball. She is a primary pediatrician and also worked with the child health equity at the Seattle Children's Hospital. Dr. Wall is of Venezuelan descent and a passionate for providing services and improving the health of the Latinx community. Please help me to welcome Dr. Wall. Thank you. Thank you for being here today.
Hi, everyone. Thanks so much for inviting me. I'm really excited to talk with you all today. I'm sharing my PowerPoint now. Is everybody able to see it?
Yes, looks great.
Yes.
Yeah, so hi, everyone. My name is Alexis Ball, and today I'll be speaking to you on the opioid epidemic in youth around the dangers of fentanyl. So before I begin, I think it's important to note how I arrived to this space, who I am, and why this topic is so important to me. So first and foremost, I'm a daughter, a sister, a tia, and a prima. I hail from a long line of strong Latina women who have taught me the power of community and family and its role in well-being and resilience. I also love people who use drugs and have family members affected by addiction and substance use. Through these relationships, I've experienced the impact of substance use and addiction on families. I've also seen the poor care individuals with addiction can receive and disparities in care within my own family based on one's identity and background. I'm also a general pediatrician and a child health equity researcher. My research is focused on addiction and substance use in pediatrics. And my goal is to leave substance-related cares, particularly among minoritized communities. And although I will be talking about the opioid epidemic in youth today, I think it is important to highlight that substance use and addiction impacts pediatrics in numerous ways, whether it is youth substance use or addiction, prenatal substance exposures, or caregivers with addiction. Substance use and addiction are fundamentally a pediatric problem. And before we talk more about fentanyl, I want to briefly review what opioids are. Essentially, they're a group of substances that interact with the mu opioid receptors in the brain that when taken can result in pain relief or euphoria, or if taken in greater amounts can result in stalled breathing, decreased heart rate, which ultimately can result in death. Opioids come from the poppy plant or can be synthesized in laboratories. Common opioids are oxycodone, hydrocodone, morphine, heroin, and fentanyl. And today I will be talking mostly about illicit fentanyl. And I want to emphasize that in healthcare settings, we do use fentanyl for anesthesia and rapid pain control. So if you hear fentanyl while in a medical setting, you shouldn't necessarily be alarmed. As many are familiar, we have been experiencing an opioid epidemic over the past 20 years. And for more than a decade, drug overdose deaths have been the leading cause of injury death in the US among young adults. This epidemic has had 3 waves, the first of which starting with prescription pills such as oxycodone in the early 2000s. And then wave 2 began in 2010 as we started improving our prescribing practices, but then we began to see a rise in heroin overdoses. And finally, around 2013, we entered in the 3rd wave, which we're currently in today, with a rise of deaths in synthetic opioids such as fentanyl. In Washington and the West Coast in general, we really started experiencing the impact of wave 3 over the past 5 years or so. Fentanyl is now the leading cause of overdose deaths among young adults. And 2021 was the deadliest year of the opioid epidemic thus far, with over 100,000 overdose deaths. And this unprecedented increase in overdose deaths has been fueled by the continued proliferation of highly lethal and potent synthetic opioids, such as illicitly manufactured fentanyl and fentanyl analogs. Fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. It has a very rapid and short effect. Experts consider 2 milligrams of fentanyl to be lethal, and this amount is incredibly small. Next to the penny, you can see what 2 milligrams of fentanyl looks like. And most illicit fentanyl in Washington state is in the tablet form, made to look like a legal prescription opioid pill, as seen in the photo on the right. Many of these counterfeit opioid pills contain up to 5 milligrams, more than twice the lethal dose of fentanyl. And fentanyl is widely available and inexpensive. In 2021, powdered fentanyl has become more common and is in the local drug supply. And then fentanyl is also contaminating other substances that are either produced in the same place or intentionally part of the product, such as Xanax, stimulants, or ecstasy, to name a few. So far, many individuals may be thinking that they're taking something such as a Xanax to help with anxiety or Adderall to study, and it really is a fake pill that is contaminated with fentanyl. And this changing drug landscape and the impact of the opioid epidemic affects all US demographics, but has been hitting adolescents particularly hard over the past several years with the emergence of fentanyl. From 2019 to 2021, median monthly overdose deaths among adolescents increased by over 100%. And you can see this denoted on the graph by the gray line. Prescription type opioid use is still widespread among adolescents and often the introduction point for adolescent opioid use. However, the recent surge in opioid deaths appears to be driven by illicit opioids such as non-prescription fentanyl. And given that fake pills look identical to real prescription pills, it is no surprise that this is happening. In fact, in 2021, while among the general population, 73% of overdose deaths involve fentanyl, whereas among adolescents, a higher percentage at 84% involved illicit fentanyl. However, from the overdose data, we are unable to tell if the overdoses were secondary to intentional use of fentanyl or not. And the recent and dramatic increases in fentanyl make for a particularly dangerous situation in adolescence. As shown here, the adolescent brain is maturing. Areas that are less developed are shown in yellow or green, and areas that are more developed are shown in blue. Brain development during adolescence makes youth particularly vulnerable to initiating substance use, the effects of substance use, and to develop substance use disorders or addictions. Essentially, the adolescent brain is all gas and no brakes or very weak brakes. This is particularly scary with fentanyl as by the nature of this development, adolescents also tend to carry beliefs about their own invincibility. Studies have shown that younger people seem to perceive more immunity to fentanyl's lethality and underestimation of the risks of addiction. Adolescents and young adults may believe that they cannot overdose or become addicted to fentanyl because they are healthy, using a pill that does not look illegal and they are not injecting it. And then another important distinction in all of this is that substance use occurs on a spectrum and that not all use is addiction, but can result in substance-related harms, such as overdosing. Addiction is a complex disease that results in continued use of a substance despite harms. So an adolescent may be using drugs casually and not have an addiction. However, they also may not fully grasp the risk of the current drug landscape with fentanyl. By the nature of their age, adolescents have a shorter drug use histories and therefore less experience using and being around people who use. They may think that they are just partying or engaging in drug experimentation, but because fentanyl is so potent and contaminating so many substances, it poses risks for quickly developing physical dependence, a use disorder, or death by opioid poisoning. And really, any use can be risky use in the world of fentanyl. Moreover, anecdotally, we're seeing a rapid onset addiction secondary to fentanyl. Whereas before, it might take half a year for an individual to develop an addiction, we're seeing in adolescents in particular that addictions to fentanyl are occurring within several months. Essentially, being an adolescent in general already shifts our paradigm of risk greater. And again, the emergence of fentanyl has only worsened that. And importantly, as overdose deaths have increased, the demographic profile of those dying has shifted and now is disproportionately affecting certain racial and ethnic minoritized populations. Notably, for youth, overdose mortality rate is highest among indigenous and native adolescents. However, if you look at the line in yellow, starting in 2019, Latina youth experienced the second highest overdose mortality rate, a trend that has not been seen amongst adults. And so something unique is happening in our communities right now. And unfortunately, along with increasing overdose mortality, minoritized youth are also less likely to be identified as having substance use disorders or addictions, report lower quality and less intensity of care, have lack of efficacious and culturally relevant treatment, and are disproportionately targeted, arrested, and incarcerated in relation to non-medical drug use. Much of these inequities are born out of the war on drugs, which has fostered a condescending moralism that conflates drug use with violence or bad character, and costs drug users as criminals who deserve punishment, furthered by drug laws and enforcement that has reflected explicit racism. And this does not even touch upon the impact of the war on drugs, which it has had on our communities' home countries, leading to so much violence and displacement of people. So given all this, what do we do? I think first and foremost, we need to keep people alive, and overdoses can turn deadly within minutes of taking drugs laced with fentanyl. So being able to act quickly might just save a life. And this is pivotal among helping young people, as potential bystanders were present during 2/3 of overdose deaths among adolescents, the majority of which occurred at home, where bystanders were often family or friends. One of the primary ways of stopping an overdose is with Narcan or naloxone. Narcan is an opioid reversal agent that works by essentially blocking the effects of opioids on the brain and restores breathing. Narcan is an incredibly safe medication and really does not cause any harm if given to someone who has not used opioids. So it is really important for us right now to both recognize the signs of an overdose, primarily being somebody being unresponsive, having a slow, irregular breathing pattern, discolored skin, small pupils, and then being prepared to give Narcan. In Washington state, there is a standing prescription for Narcan, so anyone can go to a pharmacy and pick it up without a dedicated prescription. There are also resources in King County in particular, which is where I reside, that will mail you a Narcan for free. I personally carry Narcan in my car and on my person whenever I go out. There's also a Good Samaritan law that protects someone when calling 911 to save a life if drugs are at the scene. And while fentanyl is extremely potent, you cannot overdose by simply touching it or by performing CPR on someone who has overdosed. Educating family and friends to recognize the warning signs of drug use, effectively responding to overdose, and monitoring adolescents exhibiting risk behaviors associated with drug use might improve bystander response and prevent death. And it's a really good first place to start. And part of preventing overdose deaths also comes with preventing or delaying substance use. And while teens are developmentally naturally looking for independence, they still seek parents as guidance. Teens say that when it comes to substances, their parents are their most important influence. That's why it's important to talk and listen to your teen about substances. And essentially, this really requires an ongoing conversation. Just saying don't do drugs simply doesn't work. Find a real time to connect with them and talk in an honest and open way. Avoid lectures. Ask your team what they have seen or heard about drugs or substances. Recognize that social media, TV, movies, and songs can glamorize or trivialize drug use. So engage. What are they listening to? What have they seen? What is their understanding of the current environment? And listen to your teen's opinions and questions about drugs. Discuss the reasons not to use drugs. Emphasize how drug use can affect things that are really important to your teen: sports, health, relationship, academics. And while it is important to not employ scare tactics, educate them about the real risks of fentanyl. And then, super importantly, be clear about your expectations around drug use and discuss ways to avoid peer pressure around use. What you say matters, and what your expectations are really does matter with youth. Other preventative strategies: Engage with your teen's life. Know your teen's activities and friend groups. Pay attention to what your teen likes. What are they listening to? What are they watching? Again, this will help you understand maybe TV shows or music that are glamorizing substance use or drugs. Understand where your teens are hanging out, who their friends are, and then be mindful of social media and the influences on it. Social media right now is actually a very common place that youth will be able to actually purchase drugs and substances. So it's important to know how they're currently engaging with their social media platforms, whether it be Snapchat, Instagram, TikTok. Understand what they're doing and what type of things they're seeing on that. It's also really important to establish rules and consequences. Explain your family rules, such as the expectation of not using drugs or alcohol. And if your teen breaks the rules, consistently enforce the consequences. Again, those set expectations and those rules are really important so teens and youth understand what's expected of them. And then, super importantly, provide support. Offer praise and encouragement when your teen succeeds. The strong bond between you and your youth might help prevent your teen from starting using drugs or come to you if something does come up. And then, importantly, set a good example. Evaluate your relationship with substances. Research has shown that if parents or siblings frequently use drugs or substances, alcohol, cannabis, teens are more likely to engage with it and at earlier ages. So that puts them at higher risks of substance-related harms and addictions. And if you drink, do so in moderation and model good behavior. Make sure that you're not driving after you have been drinking. And honestly, be ready to have conversations around your substance use with your teen, because questions are going to come up. What have your experiences been? What is the relationship with substances in your family? What is the relationship of substances in your cultural history? What does it mean for you to be thinking about drugs in your family? And even if you do everything right, your teenager or youth may still engage with substance use. So identifying it is very important. Among adolescents who have overdosed, nearly all deaths have involved opioids, largely fentanyl, but only a third of youth have documented opioid use history, which suggests that recent initiation of substances or using substances that have been contaminated with fentanyl, or that there is a lack of awareness of substance use by family or friends. So what are you looking for? You want to look for signs of sudden or extreme changes in friends, eating habits, sleeping habits, appearance, and performance, a sudden increase of breaking rules or withdrawing. These are things that may be a sign of drug use or honestly deteriorating mental health, or both. We do know that mental health conditions are extremely common and are also a known risk factor for substance use. So speak with your youth or your teenager about these changes in an open and non-judgmental way, and link in with your pediatrician about any concerns that you might be seeing. You can also talk with your pediatrician about how to have these conversations about substances or drugs, or starting these conversations. Use us as a resource. We want to be here to be able to help you. Also, be on the lookout for signs of drug paraphernalia or common terms or emojis for drugs that will also kind of give you some insights into whether your teen might be engaging in substances. And if you do find your teen is using drugs, it is important, again, to have a conversation about use. Explain the reality and be clear about the risk. Again, just telling your teen not to do drugs, frankly, is probably not going to be helpful and needs to have a bigger conversation. You need to review that fentanyl is something that is out there. Make sure that they understand that they know what it is, that it's tasteless, odorless, and too small to be seen. Fentanyl overdoses do not just occur from people who get drugs from random people. There is no safe source to get substances. Substances are laced with fentanyl long before they reach friends, dealers, or that trusted friend of friend. And it is imperative to employ harm reduction if your kid is using substances. ensuring that your house has Narcan, that everyone knows how to use Narcan, emphasizing to the team that they should never use alone. Narcan doesn't work if you have it in the room and you're by yourself. And also consider having test strips. Test strips are available to test drugs for the presence of fentanyl. Unfortunately, how fentanyl can be distributed in a substance means that a negative test does not mean that there's no fentanyl, but a positive test means that there definitely is. And so this can help you understand kind of whether the substance that you're using is safe. These things are really important in keeping youth alive in order to get them to the point where they can receive help or treatment, and importantly, to live out their goals and dreams. And you can do a harm reduction approach while still providing consistent messaging that no substance use is the best course of action. And then if your child does develop an opioid use disorder or an opioid addiction, so using opioids despite harms, it is important to know that there is treatment. Especially one of the best treatments that we have is a medicine called buprenorphine. It also goes by Suboxone or Subutex, might be other names that you've heard. Buprenorphine is a medicine that is FDA approved in adolescents to treat opioid use disorder or opioid addiction. This medicine manages cravings and withdrawal symptoms. It reduces illicit opioid use and decreases the risk of having an overdose. Buprenorphine lowers the risk of death by 50%. So it's really a life-saving medicine that treats opioid addiction. And yet, anecdotally, what we're seeing in Washington is many Latina youth with opioid use disorder are not wanting to take buprenorphine, even though it is a life-saving medication. And so we need to really understand what's kind of causing these trends. So that brings me back to thinking about substance-related inequities. The past slides, I have discussed ways to reduce drug use, overdoses, and increase identification, of which hopefully will decrease some of the disparities that we are seeing amongst our community's youth. However, more work is needed to address the substance-related inequities faced by our community. We need to better understand the drivers of high overdose mortality rate among Latina youth. Are there specific pressures of acculturation? Are youth experiencing discrimination, stigma regarding substance use, riskier drug supply facing our youth, or something else entirely? We also need to understand why there's such a reticence in engaging in treatment, a life-saving treatment. We need to further interrogate the impact of drug policies on Latinx communities to ensure we do not continue to perpetuate or reinvent the war on drugs. And most importantly, we need policy that supports and uplifts our communities. A quote that guides me in my thinking of much of the work that I do is responsible drug policy is about more than drugs. It is about the flourishing of entire communities. And so what policies can we adopt or think about in order to support communities in order to prevent substance use? I think that that's the goal of where we need to go. But at this exact moment, we also need to make sure that we're keeping our youth and community alive. So how do we prevent this current crisis and also work on supporting the communities that we have? And with that, I will take any questions.
Thank you. Thank you, Dr. Ball. Yes, we have some questions that have come up in the chat, so I will ask you a few of those. One of the question is, would you say that might be risk for people during surgery that might lead to become addictive?
Sorry, what was the first part of that question?
So would you say that there might be at risk for people during surgery who have received fentanyl that could become at risk to be addictive?
Yeah, so the use of fentanyl in like anesthesia, it's something that is used at a small dose in order to kind of like induce anesthesia. And so that's not something that I'd be worried about in regards to risk of addiction. It's not something that a medicine that is sent home with you. It really is, because it's a short acting medicine, that is really good in helping people undergo anesthesia. And so I wouldn't be fearful of fentanyl in anesthesia settings, because it is a very good medicine. And so again, it's just important that that's not the type of fentanyl that we're seeing right now. We're seeing illicit fentanyl out in the community.
So maybe following that, there is another question asking, how come it's so common right now that it became to be a drug that's very prevalent in the community? So there's a question of what happened.
Yeah, so I think that there's been a lot of theories about exactly what has led to this point today. One of which is that as we've continued to try to prevent substance use, and a lot of the prohibited drug policy, more or less that has led to an evolution to more potent and smaller substances in order to kind of evade regulation, evade being caught. And so that has entered into the drug supply. And with that, fentanyl is super potent, and that leads to both addiction and this risk of overdose. So it's a product that is unfortunately very successful, because it causes, and those high euphorias, and that risk of addiction.
Yeah, one of the things that we see in the treatment centers we run at CMAR, we run treatment centers what is specific for youth, residential for substance abuse. We definitely see a great amount of kids who are coming who are using fentanyl, but we also seen that the families do not know, especially Latino families do not have much information about this. So are you aware of efforts in terms of educating the Latino population? Is there presentations in Spanish that can be distributed? Any efforts to educate the Latino population?
Yeah, so I mean, I think that hopefully conversations like today are a starting point for these conversations. I know that the Latino Civic Alliance is doing a lot of work on trying to start these conversations. And I think honestly, there's not enough, there hasn't been enough on a state level of facilitating more of these conversations. And so I hope that today is a starting point that we can continue kind of this education and awareness around the risk of fentanyl.
Yeah, we had several questions that keep coming, but I know we don't have a lot of time. So I just kind of look a couple of the questions that are here. Some of the question is, why do we allow labs to continue producing Oxycontin or continue being in the market producing these drugs if we know they are so addictive? Why it is no efforts directly to stop the labs who are producing it?
Yeah, so there's the medical, again, like use of these substances, which they do have, I think, like, unfortunately, like they're good medicines in controlling pain, and they do come with this risk of like addiction. There's also good medicine, like I said, for induction of anesthesia. And so I think, unfortunately, given our history of overprescribing opioids, and we are now at the point that we have this medicine that, when we use it appropriately and understand the risks of somebody who is using it, that it is like a good medicine. But outside of that, we have kind of now this explosion of use and illicit manufactured fentanyl. And so even if we were to completely get rid of, let's say, any medical use of opioids, we would still have this illicit manufacturing of fentanyls, and that's, again, kind of currently what's in the community. And so unfortunately, I don't think that just getting rid of the production of it will kind of solve the problem that we're currently at.
Well, we want to thank you. There are some few more questions, but I know we had run out of time. We want to thank you for you to being here today. And we'll do our effort to continue and answer some of these questions online for the people who had have typed some of those questions. And kind of your contact, the contact for Dr. Ball is on the screen right now. And I'm kind of pass for the next presentation. Thank you, Dr. Walt. Thank you today for being
Thank
here
you.
with us today.
Thank you. Thank you, Claudia, so much for facilitating. Thank you, Dr. Ball. We are so fortunate to have a Latina pediatrician that really understands the opioid and fentanyl. So we definitely, you're probably going to get bombarded with a lot of calls, but we need your help, and we definitely want to be at the table, LCA, and of course, UCMAR, to continue this conversation. So thank you so much for joining us.
Thank you
All
so
right.
much for giving me the opportunity.
You bet. Our last presentation may go a few minutes late, but we're doing well, is Dr. Luis Zayas. There you are.